Thank you so much for being with us here, Dr. Ibbad Yousuf, on ITV Gold. I truly appreciate your time. How are you doing today?
Thank you for having me. I'm doing pretty good. I had an off day. Finally,
Oh,
just getting some wellness in and some rest.
definitely, and that's definitely needed for all of you medical frontliners of ours here. Thank you again for all the work that you and your team are doing. Just beginning this interview, I wanted to quickly reflect upon, the number of cases that we have as of today, which is, a million cases almost in the United States and more than 55,000 deaths. So just beginning this interview, Dr. Yousuf, looking at these, high numbers in cases and deaths, how should we as a community, process these numbers? And if you could help us understand what is happening in terms of flattening with the curve with these numbers, I think that would be great.
So the numbers are very real. I think sometimes people either get confused or we tend not to believe what we see out there on a statistical or data point of view.
Right.
In the beginning, it was very tough to have good tracking down, and even with the testing rolling out to different hospitals and different systems, I think that was one of the issues. But now that we've kind of gotten better control over tracking the number of cases and the number of deaths and knowing when to include something to be a true death.
Right.
A lot of these sudden deaths, these cardiac the respiratory arrests that ERs are seeing were COVID related for a while. I think the whole flattening the curve, the isolation and social distancing is working very well. But from the data that we're seeing, it's kind of only plateaued. Part of the flattening is allowing that plateau to go down so we could slowly start to reopen things.
Right. But this is not an immediate right away, correct? We shouldn't be calming down, especially people that are living in the areas of New York or New Jersey. Your comments on that?
Right. I agree completely. To open things very quickly and very rapidly, I think personally would be a mistake. There are still at-risk populations. The elderly, people with comorbidities, people with autoimmune conditions, etc., who I think we need to even consider extending isolation for until we have better control. I was discussing with some of my friends, some physicians, non-physicians as well, the other day.
Right.
One of the ideas I personally has was to kind of start rolling out people who are healthy, who have had positive tests and or negative tests, to start opening up more essential things in
Right.
in the world, in industry.
Right. But in terms of actually reopening a state, how much testing, according to you, is required? And how much hospital capacity is needed so that in case there is an increased number of COVID cases, there is enough room for them?
So I think that's difficult to answer directly. I know most of the hospital systems that my friends are at, mine personally, we were stressed to capacity. We're still essentially at capacity, even though the overall volume coming through the ERs has slowed down. Testing is still an issue because there isn't really great testing available. The nasopharyngeal swab, which we were using for a while, even has a lower end of the sensitivity, between 60 and 80%. The average is 70% from when we're looking at it.
Right.
There were people coming in with negative swabs or had 2 negative swabs who very clearly had COVID-related disease on the X-ray and based off of the laboratory work and what we were seeing clinically. So I think that's also part of the issue is we're still waiting for these tests to get better. I know you mentioned the antibody tests. These are all also fairly new things. With any kind of test, whether it's for coronavirus or influenza or even strep throat, there is false negative and false positive rates.
Right. So we're
So
trying
when
to
we
get
look at it,
less of false negatives, correct?
right. So we want to reduce the false negatives and reduce the false positives. So that makes our window tighter for true accuracy for testing.
That's a lot of work ahead for doctors. They're currently
It
also
is.
working for it.
It is. I was actually making a comment the other day, even just the simple workflow of taking another swab, and even looking forward to flu season, doing another swab for the nurses, the physicians, everyone who's actually at the front and doing these things. It's an extra order. It's an extra, piece of material. It's an extra process. The label, it's an extra piece for the lab.
Right.
These things all add up in the system from the more minute end, which, a lot of the general public doesn't necessarily see. It could be between a minute and a few minutes per patient, and sometimes that's the difference in a life.
Wow. And this is happening while we're already hearing, the news of a second surge, which they're expecting either in the fall or they're expecting in winter. So I'm assuming that these tests are going to play a very important role, and the roles of, hospitals and manage the cases also are going to play a very important role in managing what happens. Do you believe there would be a second surge, or is there enough news about it?
So based off of the data, I guess we have from previous epidemics and pandemics, there tends to be a second spike. I know we are currently, worried for it or anxious for it and preparing for it, just so that we don't get caught the same we did when the first peak happened. Based off of the historical data we have in other, pandemics and epidemics, it seems if we open up too quickly, that spike can go higher than the initial one, based off of the phases and the epidemiologic data. So I think that's what we're kind of right now trying to focus on, seeing where the data is going, seeing what's happening to patients overall. So.
Wow. While we're talking about this, the reason I asked you was because you have kind of openly and publicly shared your experience in the emergency room. That's where you work, and we're constantly hearing about, the issues of the ERs, how they're packed, how at a certain point it was a war zone. And I wanted to know if that is still the case in certain hospitals, or are certain, doctors still experiencing those issues? And if not, what kind of changes are there to the ER? Has it helped the situation now?
So I think the initial comparison with that first peak with
Right.
war zone was more of an analogy. I've never been in war myself. I'm not a soldier. But the amount of chaos, the amount of death, people in the ER are used to serious conditions, strokes, heart attacks. In certain trauma ERs, you see the loss of life and limb and gang violence and a lot of horrible things.
Right.
That initial peak kind of caught us to an extent where we didn't know a lot about the disease. We didn't know a lot about how to provide supportive care, when to escalate care, which medications may or may not work. There was no data. I think we are a little bit better prepared in that sense. We do know what to look for clinically a little bit more. In general, the ERs, at least mine, has slowed down. From talking to different friends in the area in New York City, they're also kind of it's an eerie calm though. We're starting to get a trickle in of the things that ERs saw before the pandemic.
Right.
So that's either a good sign or a bad sign. Sometimes people might be waiting too long for their heart attack or what they thought might be a stroke or something like that. So I think, that is the image that is going on right now. So.
And in terms of, asking you another question with medicine, I have to ask you, PPEs, they have been discussed nationally. Even now we're talking about many hospitals in New York still not having enough PPEs, doctors asking for people to donate PPEs if possible. Your take on how important these were in the initial days of COVID, and how has the process been now that certain hospitals have been getting them?
So PP is very important. I know the media, it was a huge issue with people realizing that hospitals in general weren't necessarily prepared for a pandemic. And it's beyond the hospital systems, which people don't necessarily understand. It's not necessarily to the fault of a particular hospital. A lot of our manufacturing systems and global supply chain was disrupted.
Wow.
personally, I know myself and a bunch of my colleagues, we all either purchased or the department or the hospital helped us get respirator masks, which are reusable. You could wash the outside, you could remove the filters and add new filters on. I know that that's helped a lot in reducing the one-time use, or what was supposed to be the one-time use, N95 masks. It still is just as important. We still treat every patient as if they were to have an infectious disease, whether it's coronavirus or something else. I think that's also an important point I had mentioned to some friends the other day, was in the ER, you're getting an undifferentiated patient. So part of your duty on any given day could be taking care of somebody who has something communicable, whether through aerosols or cough or droplet or through blood. And this kind of points out the importance of PPE in that overall sense. I think there was a kind of a relaxed attitude overall in ERs.
Right.
I know a lot of my mentors and supervisors and attending physicians always mentioned, always go in as if you can catch something. I think some of the latest data, there was a report the other day that was showing that SARS-CoV-2, the coronavirus, can stay on N95 masks for up to a week.
Oh, wow.
So that kind of raises a question with our use of these masks in certain places and stuff like that. So,
could you describe to our viewers how much PPE you have to wear, and just from like top to bottom, how much you have to cover yourself in order to treat one patient in the ER?
It's uncomfortable. That's the best way I can at least describe it. I have my respirator mask, which has two filters built on. It creates a suction seal. It has 4 straps that tie up on the top and at the bottom. And then there's a valve so that you can get some breath in. You still get very dizzy in it. You're still breathing in a lot of your own carbon dioxide. They're uncomfortable. They're tight on your face. That's probably the most important thing. We have seen that there are cases that have ocular transmission. Right. So I know when we're doing invasive procedures, the intubations, placing central lines, in the internal jugular vein, I always wear my glasses. We have goggles, glasses, and or a shield on top of that. Wow. Had a lot of people reach out and help support. A lot of 3D printing companies have helped build us shields.
Right.
As the global supply chain was disrupted. And then just the gowns. I think gowns are typically short in most places. It's not something that we, anticipated as much. I think these are the typical sterile gowns that, surgeons would wear in the OR or when we're doing invasive procedures in the ER. Those tend to be better used. I know a bunch of us have personally sourced essentially the full body suits.
Wow.
Made from Tyvek kind of material or certain plastic type of materials that are washable and reusable. So that's what I've been using now. It's the full suit.
Wow.
On top of the mask, with the goggles, I have a surgical hair cover, and then the face shield, just to minimize the surface area that's touching my body and possible exposure to the risk of the virus.
Wow, that is incredible. That is a lot of material that you have to wear in order to treat one patient. Just talking about patients, I would like to highlight some of the high-risk patients whose questions you've been getting. In the South Asian American population, Dr. Yousuf, we see a lot of heart patients, stroke patients, you have diabetes, blood pressure, high cholesterol, you name it. And we have certain of these, high at-risk patients. Your comments on what you've seen with those patients, especially with COVID-related issues in the ER, and also maybe a word of advice to them into how they should take care of themselves or when they should go see a doctor if they are worried.
Thank you very much for bringing up this point. I think it's especially important in the South Asian, the Desi community. My father himself has the same high blood pressure, high cholesterol, diabetes. He's actually had heart surgery, open heart.
Wow.
And I'm very scared for him. I haven't seen him or my mother in, a few months now. I've been telling them to maintain the strictest precautions just because they are at a higher risk. Not going out if they don't need to. My younger brother is at home with them. He's helping get groceries when are needed. And they're kind of just staying in the home where we're lucky to have a backyard. They've been walking around, getting fresh air. But it's real. The data we're finding is that people with these comorbid issues are at higher risk. We're still trying to work out the science as to why. There's a few theories out there on the microbiology and the cellular biology of receptors and what these diseases do to the body as far as the pathophysiology.
Right.
The whole going to see your physician, a lot of primary care physicians, even ERs are now doing telehealth. So I think to use it at the beginning,
right.
If something feels off, people know their bodies very well. So if something feels off and you're kind of scared to go to the ER, call into your physician, call into your doctor, call into your provider,
right.
Have them, give you a quick assessment. And then if they think you need a higher level of care, then you should definitely go to the hospital. Definitely go to the ER. Don't be scared to go to the ER, in fear of catching this or, in fear of lightening our load per se. We're here to help. And that's actually one of the things we found as far as our data is a lot of the heart attacks and the things that typically came through an ER are kind of slowed down for a while. And we're just trying to digest all of that data right now. So.
Wow. So they just have to watch out and they really have to take, measures to make sure that they are taking care of themselves.
Yes, definitely. The at-home self-care is important. Trying to get a little fresh air if you could in your yard, stay isolated, wear your mask, keep washing your hands. Soap and water are great for this. At least 20 seconds, hot water, in and out of your fingertips, in and out of the fingers, all around. It's the most simple defense.
Dr. Yousuf, you work in critical care, which has literally drastically changed in the way it functions and the way it looks in the last month and a half. If I was to ask you, what are your current challenges, the greatest challenges right now, what would you say?
I think from the medical end is being able to attempt to try to stratify some of these patients. Some people who come in either, the mild, moderate, severe risk category. Because as a medical community, we're still developing data. We're still trying to see who, might be safe to send home, who might be safe to keep for a day or two, who's going to require the severe most form of critical care. I think one of the scariest things in the beginning of this was what we called walking hypoxia, which were the patients who were talking to you, texting on their cell phone. They looked well, but their oxygen saturation in their blood was 85%, 80%. And that was very atypical for the medical community to see. It still is. I think trying to dig through that and see, how we can best help some of these patients is one of the biggest issues right now.
Right.
We're still learning a lot about the actual disease.
Right.
And what it's doing to the body as far as we've seen different clotting cascades and hypercoagulability, thickened blood essentially. We're trying to figure out why and how. We've seen the heart get damaged, the kidneys get damaged. It's a pretty nasty bug that we're still trying to figure out. So.
What about in terms of the drug trials that we keep on hearing about, the medications that, the FDA is still working on, and also the vaccination? Any insight into how long that could take and what people should know about these drugs, since we're hearing them in media so much?
So first and foremost, please have a discussion with your physician. Don't just go out and get these medications. Don't hoard these medications. Almost every medication has a side effect, whether it's a common side effect or a rare side effect. This is something a talk that I always have with my patients before coronavirus. Anytime we put them on something or we have to take them off of something, whether they had a side effect with it. The larger trials right now for some of the medications that are being talked about most haven't really shown great promise, unfortunately. It's some trials are showing great promise, some trials are not. The bigger trials that look at the data more thoroughly, you know, the controlled retrospective trials, the meta-analysis, aren't showing great outcomes as far as the medication's helping, per se. I think that's an issue that the public needs to be aware about in understanding there isn't just a magic cure or a magic, you know, bullet for this thing.
Wow.
One of the things we're also trying to learn is, you know, for these medications that have shown good outcomes in certain trials, I think the timing of disease, a lot of scientists and researchers are looking at if we're starting at a certain early or late time, if that makes a difference. And that's part of the issue with this virus, is that the disease course is so varied from patient to patient. Some people are coming in very, very sick on their third or fourth day of disease. Some people are coming in 2 weeks later. I've read cases of people testing negative for 2 weeks and then getting very, very sick in a third week. Again, some are outliers, and there is a general curve that a lot of these patients fit, but there's still so much data to be collected and a lot to learn.
Wow. So then how do we all protect ourselves? You know, that's like the end question that everyone is asking. That how do we protect ourselves? How do we build immunity? Mental health awareness is another thing that people are trying to ask questions about too. What are your suggestions on it? It is a scary situation, you know, and people just want to know how they can stay safe.
I think you brought up a few good points. The whole vaccine thing, which I didn't touch on, is going to take time.
Right.
Good vaccines take time. I think mumps, took a few years to develop. That's one of our better ones, or measles. The MMRs combined in one vaccine. But we have technology today, luckily, that allows us to speed up some of these processes. However, it doesn't speed things up completely. So the way human trials works is in phases, the same way as disease spreads in phases, and you have to get the scientific literature, and then you have to have the literature to test animal models and human trials, and then, you know, population data, essentially. I wouldn't be so worried about a vaccine. Let the scientists do what they have to do. When a vaccine is available, it will become available. Right now, that's not something that us, even, you know, in the front of an ER, can control. As far as mental health awareness, you know, these are very trying times for everyone. Everybody is going through something.
Right.
Whether you're in healthcare or you're not in healthcare, whether you're old or young, or, you know, it doesn't matter what your race is, whether you have wealth or if you don't, this is affecting everybody. And I think understanding that gives a little insight and gives you a little, at least it does for me, it gives me a little empathy to see, hey, this is going to affect everybody in a different way.
Right.
You know, I know ER physicians and people in the hospital, we are very nervous. We're very anxious every day going into work. It is a very mellow, humble, quiet, you know, shift every time. We try to laugh or smile when we can and crack jokes and on a down moment because you have to.
Right.
The whole mental health awareness thing is real. I would suggest people reach out to those who they know struggle with mental health issues. A lot of times people undergoing mental health issues don't know how, or they don't have the ability to reach out to their loved ones or friends. So that's one thing that we can do as a collective, as a group, as a community, is reach out to people.
Right.
You know, I know a lot of people, friends who I haven't spoken to in years, have reached out, hey, how's everything going? And it means a lot. It's definitely a nice gesture, personally, and it works for everyone else too. So.
What do you have to say about the unity or the camaraderie of the medical community, the entire healthcare system that you've seen in the last few months? And what's the message you like to give to your fellow colleagues?
The message I'd like to give is to just, you know, keep fighting. We're all in this together. I, for one, have been very proud at how, my colleagues and I have come even closer together. I think most people in any ER or ICU or in these high stress environments know how much teamwork it takes just to get by a regular day. From what I've been seeing in the medical community, everybody across the world has gotten together to join in this fight, and that's pretty amazing. The researchers from other countries, the scientists, the physicians, all the different symptoms we're seeing, all the different ways we're using to treat or support care. I know Facebook, not Facebook directly, but physicians have come together. There's 20, 30,000 person physician groups just serving as think tanks and sharing data and journals and their own anecdotal cases. That's pretty amazing. It's pretty amazing in that sense. One of my inklings for science was how the scientific community works in that area. That's pretty cool.
That is really cool, for sure. We're coming to a close of this interview, but I have 2 more questions left for you. Number 1 would be, what is your focus for the next week and a half or the next 2 weeks? What are you hoping and what are you predicting in terms of, critical care, patient care, and just handling the entire situations?
I would be lying if I told you that I'm looking a week ahead. It's essentially a day at a time kind of thing. I know myself, I wake up, I go through my daily morning routine, and it's what can I do today? How can I best help the patients today? How can I stay safest for myself? How can I reach out to one person today kind of thing? To look a week, 2 weeks ahead, kind of just bigger picture, I guess, and where this is all going, trying to stay up to date on the data and the science of testing and all the same questions that the general public is worried about and anxious to see where it goes.
Definitely. Well, thank you for your time here on ITV Gold. Just
the
last message to our audience, if you could give them. Maybe a suggestion.
The suggestion or message, try not to be anxious, try not to panic. I know it's scary. I know what we're seeing in the news is scary. I can be scared myself, my colleagues, my family, my friends are all scared. You just have to try to take things a day at a time. Humans have been through a lot before, and we'll get through this too.